Great. Welcome, everyone. Thank you so much for joining us today. Today's webinar is going to be celebrating our 2024 Increased Access to Care for Agricultural Workers Promising Practice Award recipients. Today's webinar is presented by NCFH in collaboration with the Ag Worker Access Campaign. Next slide. So today we have three main objectives. We're going to talk a little bit about the Ag Worker Access Campaign and our task force to give a little background and kind of the history of the Promising Practices Award. And then we're going to hear from our Promising Practice Award winners and get an understanding of their health center programs and the great strategies and work that they're doing to increase access to care for migratory and seasonal agricultural workers. And then we're going to have some time to open up and answer some questions from you all for our Promising Practice Award winners, any questions you have for them and learning more about their work. Next slide. So first, we'll start with a little bit of background on the campaign and how the IAC program and the Promising Practice Award came to be. So our Ag Worker Access Campaign is a national initiative with the goal of increasing the number of migratory and seasonal agricultural workers and their families served in health centers. This initiative began in 2015 as an effort from the National Center for Farmworker Health and NAC, the National Association of Community Health Centers. They saw that more could be done to increase access to care for this population, and thus the campaign was born. Next slide. And our overarching goal is to reach 2 million agricultural workers and their families served in health centers. There's about 4.5 million agricultural workers in the US, and we've seen steady progress over the years since 2015 with a few increases and decreases as we deal with things like the pandemic and COVID-19, and we've really seen health centers work tirelessly towards reaching this population and adapting to the challenges that are out there in reaching the population and increasing access to care to services for them. And this is where the campaign and the campaign task force comes into play. So our focus, we have four main focuses. The first is to understand and identify the unique needs and barriers that this population faces in accessing care, ensuring that health center staff receive the training and assistance they need to effectively outreach to their ag worker population, and also to accurately classify and report them in UDS to ensure their health center funding. And third, to identify and disseminate promising practices for increasing access to care, like we're doing today, and supporting local, regional, and state coalitions between health centers and other ag worker serving entities. Next slide. And to address all of those campaign focuses, the campaign is guided by a task force. Our task force works to meet and identify challenges that are happening across the country, explore and launch innovation, formulate recommendations, support collaboration and coalition building, and identify and disseminate promising practices. And on our next slide, we have a graphic that shows where our task force members are from. We're from all over the country, very representative of many of the regions, and the task force members consist of health centers, primary care associations, health center controlled networks, national training and technical assistance partners, and other organizations representing housing, education, labor. We all work together to guide the direction of the campaign. Next slide. And from the campaign, to address some of the training and TA needs that health centers have for increasing access to care, was born the Increased Access to Care program. So this program is a nationwide network of health centers, health center controlled networks, and PCAs that are committed to training, action planning, UDS data tracking, and peer-to-peer exchange of strategies with the goal of increasing access to care for ag workers and their families. And some of the ways the IAC program supports health centers to reach their increased access goals is through training on ag worker identification, developing migrant health action plans to reach goals, peer-to-peer exchange of strategies through webinars like today, through our learning collaboratives, and ongoing technical assistance. And next slide. And to highlight and elevate those promising practices that health centers across the country are implementing to increase access to care. Part of the IAC program is our yearly Increase Access to Care Promising Practices Award. This award is a yearly award that we use to showcase and recognize 1 to 2 health centers for their commitment to this population and the strategies that they use to reach, provide services, and increase access for their ag worker populations in their states and regions. So on this slide, you can see some of the past health center recipients, and the link in the chat to our website can share a little bit more. But without further ado, I do want to introduce our 2024 Promising Practice Award winners and turn the stage over to them to share about their great work. So on our next slide, our 2024 award winner recipients are Finger Lakes Community Health in New York and Bluegrass Community Health Center in Kentucky. And both of these health centers were officially recognized at the NAC Conference for Agricultural Worker Health last week in Atlanta, Georgia. These are 2 pictures from the conference of our health centers receiving their awards. And I'm going to turn it over to our Finger Lakes team to start to share a little bit about their health center and their work to increase access to care, some of their strategies. As Vanessa shared at the beginning, feel free to use the chat or the Q&A box to send in your questions throughout, and we'll have time for both health centers to address questions later in the webinar. So I'm going to turn it over to Serene.
Yes, great. Thank you, Katie.
Thank
So you'll
you.
notice in the presentation that it's being presented by Ruth Matafari, who is one of our key players in our advocacy or financial advocacy work. However, something unexpected came up and she's not able to attend. So in the next slide, you'll notice that I am not her. This is her picture, but I'm happy to step in here with her. My name's Serene. I'm the Chief Innovation Officer for Finger Lakes Community Health. So with questions, you're welcome to reach out to Ruth, and between her and I will answer questions that come up. I have been working with the team in the organization for quite some time. We are a federally qualified health center in the Finger Lakes region in New York State. We started being really focused on our agricultural workers, and we are now a full-fledged health center where we provide medical, dental, behavioral health services, and have quite a bit of support services available to our patients, including financial advocacy. And in the next slide, you'll be able to see our current services that we are serving right now. And it's been nice to see over the years how this program has evolved over time, and how in New York State the insurance enrollment process has changed, where it has gone from paper to online and digital, and just evolved. What can I do for you? Oh, sorry, my Siri's speaking to me. How it has evolved over time and just expanded. And we have been pretty lucky in New York State as well, because we were able to expand our services to folks that are able to qualify for the service based on their income versus on their legal status. But currently today, we really leverage not only our financial advocates that are here, because We get them certified to be financial, so to be certified within our state to be able to do those financial applications for insurance enrollment, but then also to look at other avenues where we can support our patients, to really meet our patients where they are at, right? To see what is available to them and what can be done. The last resort would be hardship letters, or reaching out to the actual companies that have the medications or the pharmacies to help our patients through the work. But our between our administrative folks, or C-suite members, or people looking for funding to bring resources in to support the staff that we hold, and then the collaboration with our community partners, letting them know that we're around, and continuing to promote the work that we do, collaborating with the hospitals and the specialists, really helps with all of the outreach and all the work that we do together. Next slide. So what we've really done is, after COVID, right? COVID just kind of changed quite a bit for everyone, where we've kind of had to pull back. But what we ended up doing post-COVID, or it was going back into our ag worker camps, where we actually went with our in-camp team, who provide clinical services. When they were doing their screenings for people to come into the health center to be getting clinical care, our financial advocates were also coming in and saying, let's get you insured, let's get you on insurance, because you never know. Even if you're the healthiest of healthiest, emergencies do happen, and that could be a real hit on your financial stability once you go to the emergency room if you don't have any health insurance. So we ensured that we were able to reach out with our collaborate with our clinical folks to be doing those visits, and getting the patients to be aware with that. And because of this all this post-COVID funding that was out there, we were able to get additional funding to expand those outreach services. And also, we continue to increase the training and the specialized work within our team. In our team, which later on you'll see who the variety of the people that we have on there, the group consists of financial advocates, but each individual has their own niche. There may be a person that's really well versed and focused on our Medicare, older patient care services, with all those special services that come with Medicare and Plan B, Plan A, and there's somebody else that might be more well versed on the legal component of the types of immigration status that people can have to get certain types of insurances. So we're really taking as our logo. My marketing team would be very proud of me, taking the time to care tagline. We do take the time to care for meeting the patients where they are, but also ensuring that our staff, our financial advocates, are also comfortable in the work that they are doing, that they are getting into the niches that they do, because each piece is a little bit different, because insurance enrollment in itself is pretty broad. There's high deductibles and all these different components of it. So we do rely on our team and each other to support each other. If I have a client who needs a specific type of insurance or specific product, I can go to a team member who specializes in that work. And we collaborate with other partners, like I said earlier, where we're able to get more referrals, or at least let them tell their customers, the folks, to say, look, if you reach out to Finger Lakes Community Health, they have bilingual staff, they're able to help you get on insurance, connect you with other resources to get into care. So we're able to expand our catchment area by getting those connections with our partners, and continue those two-way conversations. Next slide. So in the next slide here, you can see that we have a variety of different people that are able to support the staff. Ruth and myself have done insurance enrollment for many years. We continue to do the work. The folks here, their specialty is insurance enrollment, but that's not all that they do. A lot of times they wear different hats. So some of these folks are part of our answering a service where they call our 800 number and are able to quickly get connected with somebody that needs to get on insurance enrollment or get applications for something, right? And the team is able to work not only with our patients, but they also go above and beyond to work with their employers to get their pay stubs or ensure that they're getting their residential confirmations to the proof of residency, right? Or figuring out where's their birth certificate from their country and getting that brought over and getting it translated in a timely manner. So the team really plays well in using each other as a service, but they're spread out throughout our area and are able to connect them with the resources that fits them most. Next slide, please. So when we first were doing the service, we really were in the Finger Lakes area, which is the blue circle place there, and now we have expanded outward, and a lot of this work is based on the ability to leverage the technology that we have available to us. We are here on a video call, real time. You're able to ask questions, do a variety of different things. So we're always pushing the envelope to maximize the resources that we can do. And even pre-COVID, we were already having virtual meetings with patients to be able to get them on insurance. So we were able to use the scanning capabilities and be able to do a face-to-face visit where you can see me, I can see you via video, and do the insurance application and get copy of the documents that were needed. And this continued and has just grown and developed and expanded over time. So with our collaborating partners and other organizations that we worked through, it just has evolved to grow and getting more support or more people needing assistance because of the great work that the team does to be able to go above and beyond to ensure that the patient gets the resources that they need to get on insurance. Next slide. So one way that we have done this piece is to really have everybody know where they can get support. So one piece is by having our calls be when people call in, whether it's through our call center or our 800 number, we're able to connect our patients with our financial advocates. We also distributed the team within our health centers, and they are always readily available to support the not only the clinical staff but the support staff that are there. When they're in meetings, they pipe in and they say, I'm here, I can do insurance enrollment, or here are some updates of what's available for insurance. Don't forget we have insurance. So they're always drumming up business. They're always making sure that they are well known and noticed by not only our own staff in our health centers, but also among the community out and about. There's flyers everywhere, putting places where they think that there's a lot of traffic that people can get their information. So we try to get as much awareness out there and keep the insurance piece in the forefront for people, because that is a big barrier to getting care, right? That's one big piece that people always think about as to how can the person get access. And then we also use it every time that we're trying to connect a patient, even if they're not in our state to do work. If somebody calls us to do an out-of-state linkage, looking to go to another place, we're making sure that they are connecting for insurance enrollment in that state and figuring out how can they get their health care taken care of, so that does not become a burden on getting their treatment done. Next slide. So here's just some information that helps understand New York State. New York State, we do, like I said, we do have some great services for our patients. Any child under 19 is able to get on health insurance regardless of their legal status. And if it's based on income, so you can have insurance which covers medical, dental, behavioral health and prescriptions at no cost if your income qualifies for it, or there's a tier, so you're able to get insurance for kiddos. So anybody under 19, we quickly get them on because they're able to get great insurance and get the care that's needed. If you're pregnant, again, if you qualify it's all based on income, you're able to get on insurance, and then it's able to expand even further. There's also emergency Medicaid that's able to support that. So regardless of your legal status, there's opportunities for people to get care and continued care based on income or what's available to them. So we have been able to really take advantage of that opportunity and spread the awareness to our patients to say, even though you may not think that you need it because you're healthy, you should always just have it as a safety net because something might come up or maybe needed for a later time. So it is great that legal status is not a barrier for folks. It really does come down to the income where they are in the income guidelines for folks to be able to get on insurance. But because of that opportunity, our staff really go up above and beyond to really let people know that they can get on insurance, and there's different ways to make it more financially effective for families to get on one insurance versus another so that they can continue to take care of their families. And that's all I have on the financial advocacy work. This is the team. You can go to our website and learn more about Finger Lakes Community Health. And I'll pass it back to you.
Thank you, Serene. There's contact information there to ask additional questions, and we'll keep capturing questions in the chat for you all and answer that during our Q&A time. But thank you so much for sharing your important work. And we also have our Bluegrass Community Health team here from Kentucky, and I'm going to turn it over to Elizabeth and her team to share a little bit about their work.
Hi, thank you all. Good afternoon. Like Katie said, my name is Elizabeth. I'm the Director of Clinical Operations at Bluegrass Community Health Center, but I also have other members of the team, including Patrick Hughes. He is one of our nurse practitioners, and Angel Watkins, she's our Clinical Outreach Manager, and then Vanessa Garcia, she is one of our amazing community health workers. Next slide. Next slide, please. Thank you. So a little bit about us. We were established in 2001 through Eastern Kentucky University as a clinic for migratory and seasonal agricultural workers. So this was the first of its kind in Kentucky. We became an FQHC in 2006 as a co-applicant with EKU, Eastern Kentucky University. In 2020, we became our own independent federally qualified healthcare center. And our mission is to provide accessible health home that promotes better health, better life, and serves all people with care and respect. We are a patient-centered integrated medical home that provides comprehensive primary care for adults and children. And we serve agricultural workers and their families in both fixed clinics, at our school-based clinic in Clark County, mobile clinics, and at outreach settings. And these are just some of the pictures of some of our sites and our mobile clinic. We've definitely grown a lot in the last few years, and we're really proud of all the locations and our sites. Next slide, please. So population served. So in 2023, we served over 10,000 patients in 8 county service areas. So this is located in central Kentucky. So Fayette County is where most of our clinic sites are in Lexington, but we also serve the surrounding counties in the central Kentucky area. So a little bit more about our demographics. So in 2023, we served a total of 4,048 Hispanic, Latino, or Spanish origin patients. And of these, 1,602 were agricultural workers or their family members. And then a little bit about our income or percentage of our poverty guidelines. So 100% or below, we had 3,697 patients, and then 160 were over that 200% poverty level. And then our Medicaid or not our uninsured, but our Medicaid population is a big bulk as well of our population group. So 18 plus, we had over 3,000 patients with Medicaid, and then under 18, we had a little over 1,000 who have Medicaid. And then these are our uninsured numbers. 18 plus, over 3,000, and under 18 who are uninsured patients are 331. Next slide, please. We've been increasing access to care. This past year, we established a new clinical site at Centro de San Juan Diego. So this site is not too far from one of our main clinics in Lexington. However, it is a community center that sees a lot of migrant workers or other Latinx patients within the community. So we've tried or did like a trial of going there and seeing how many patients we were going to see and seeing if they overlapped. And surprisingly, there were a lot of new patients, even though it is in close proximity to our Versailles Road location. We've also do outreach to local farms. So our big agricultural farms that we see in our region are horse racing and other horse farms. We do have other agricultural farms in our region, but these are the main areas that we see in more of central Kentucky. We also have established a mobile clinic in the past year, which is helping to increase access to care. We can have all these nice, pretty buildings, but it doesn't mean people are going to come to us. So we decided to improve our access by going to them. We also partner with groups such as Kentucky Racing. So this is a program within Kingland Racetrack in Lexington that helps provide insurance to their workers. So we see them at a discounted rate, and they provide them with this Kentucky Racing insurance. And also, like Finger Lakes had said, word of mouth and great customer service. This is what really helps us increase access to care. We provide well patient-centered care, and then they go back and tell their friends, their family, community members, and help get others connected to our services. Also, having a multilingual staff, diverse team, really helps us increase access to care within the community. So this goes across the board from clerical, clinical providers, our support staff, community health workers. Next slide, please. And a little bit more about our support team. So we have community health workers, care coordinators, peer support, behavioral health, and of course our providers and clinical staff as well. And we speak a lot of different languages here at Bluegrass Community Health Center. We also work a lot with refugees. So these are just a list of the languages that our staff speak here, but the majority being Spanish, and across the board, we have multiple multilingual staff that are here to assist patients. Next slide, please. So some challenges, of course, social determinants of health is a big challenge in our region, whether that be transportation to our sites, assistance with housing, access to medical care. Also, buy-in from local organizations can definitely be a challenge. It is good to have partnerships and access to different resources, but sometimes we have organizations that say, oh yeah, this is a good idea, but then we have a hard time connecting those dots, whether that be limited time that they want their staff to be off during the day. For example, if we do some outreach events, sometimes we'll say, okay, you can come for 30 minutes during their lunch break and that's it. So sometimes that can definitely be a challenge for us. And then access to specialty care as well. We are lucky that in Lexington, we do have a lot of specialty care here. However, it can be a challenge for our non-English speaking patients, our uninsured patients to get connected to specialty care, which is one reason we've really increased our community health worker team to help connect our patients, as well as our care coordinators and referral coordinators. And some of our future goals, we would love to increase our Latinx groups and classes, whether that be an increase in diabetes type groups or other ways to adjust to coming and being in our region. Also continue to have professional relationships with other community partners and resources. Just getting out there, going to health fairs, talking with people, being in the community and communicating is a good way to get to know different resources and trying to form partnerships. And then, of course, continue to grow our clinical sites. There's definitely a need in our region, both rural and urban areas. There's a need for primary care and services. So it is our goal to continue to expand and offer our services to the community. Next slide. And thank you very much for your all's time. And we couldn't have done this without the support staff. So special thank you to Patrick Hughes, Angel Watkins, and Vanessa, and the rest of our team for getting out there, working tirelessly day by day to help provide the best care to our patients in the community.
Thanks, Elizabeth. Okay, so we're going to transition to our Q&A time to ask both teams questions. We heard a lot of great strategies and work that's being done around insurance access and going and meeting farm workers where they are through mobile clinics and having diverse multilingual staff. So I'm going to, next slide, turn it over to one of our campaign task force members, Cindy Selmy from Health Outreach Partners to help facilitate our Q&A portion. So I'll turn it over to Cindy and put all your questions in the chat for our award winners.
Thank you, Katie. I'm going to start off with a question for Finger Lakes team. The question we have is, how do you remove some of the fear associated with sharing personal information when working on getting farm workers enrolled in health insurance? Has this been an issue?
There has been an issue in the past where people were concerned about where does this information go and how does this impact their legal status down the road, and having that clear understanding, because there has been situations where there has been miscommunication, confusion among the community as to what would happen if they get on insurance. And it really does come down to that trust factor and having the resources, or be able to take them to show them resources to say, look, at this is where you're able to get the information, whether it's through some legal aid assistance or other areas that have that credibility on the legal component of it. And for us to be able to say, we're trying to get you the healthcare that you need, very much aware of the legal component down the road and insurance or legal status, and even just being able to have the proper documentation on birth certificates and proper naming at when crossing country border lines, right? So having that safety, trust awareness within the community to know that the staff at this organization is one to trust, and having that history among the staff is key. And sometimes it's even hard because as you transition from staff members to another staff member, staff or patients still want to go to that staff member. Staff will move up or transition into different roles, and we'll move the patients onto another person that's taking on the caseload, and patients will still want to keep calling the other person that was doing the work before because of the trust component, and we handhold and say this is the person that can help you, and they're doing the work just the same, and they're not going to take your information elsewhere, and they're guiding you to the right places. And if there's still concerns about trust, then we'll take them to other agencies that have more of the weight, like I was saying earlier about the legal component, because they have the legal laws behind it, and they're able to give them more resources. But sometimes it does come up in the community if there's understandings within the community. A lot of times because of we've been here since 1989, we have a history in the community, and there's comfort level, and that word of mouth does help quite a bit. So ensuring that we don't lose that trust factor is key.
Thank you. Thank you so much for that. I'm going to move to a question that was in the chat, and I want to leave it up to both health centers to answer. So maybe Bluegrass can start. Our participant is wondering if physical therapy is part of the services provided to agricultural workers. Do you guys want to start from Bluegrass?
Yeah, so we don't have it in-house. We would love to get it. There are some resources within Lexington that offer it for a discounted or free rate, which is good. However, there is definitely still a need. One of the centers that we're working at, Centro de San Juan Diego, they are working on getting some of these specialty cares like physical therapy there in order to help provide this for a reduced or free cost. So it's definitely in the works. There is a need. We do have a little bit of options, but it can be a challenge for sure.
Yeah, great. Thank you. How about Finger Lakes?
Yeah, for us at Finger Lakes, we do not have physical therapy on our scope, but we do collaborate with specialists through our voucher program, where we're able to send ag workers there, and through a reduced rate and sliding fee scale are able to have our patients go at a reduced dollar amount, or if they have health insurance, cover the cost for it.
Great.
And then we collaborate with interpretation and transportation if that's needed.
Awesome. Thank you so much. This is another question that could be answered by either health center, but we'll start with Finger Lakes regarding connecting farm workers with coverage in other states. And I'm guessing Medicaid coverage. Have you established contacts in other states, or are you providing general information and contacts for states other than your own regarding Medicaid enrollment?
So when people transfer from our state to another state, or people are calling us because they're coming our way, we use the HRSA's website that shows the other FQHCs that are in the area. And we go as far as having the patient on the phone and doing a three-way call and making those soft handoffs and saying this person needs to get care and they need health insurance. What is available for this patient in that state? Can they apply for health insurance, or their family? So that the person that's on the phone gets that resource and awareness, but then we do too of that state. And then if we have regular clients that come from a specific state, like we have people that come from Texas, and we work with the states to be like, what's easiest? Is it better for, or what's that state's scenario? Because some states it's a little bit harder to get on insurance, and they don't want to get off of it because it's hard to get back on. So is it easier just to keep their insurance and have us figure out different alternatives to get their payments taken care of while they're here for only a couple of months? So we try to figure those pieces out between the places that the person is coming from. So our staff really go into looking to talk to whoever their caseworker is for that particular state that they're in. We don't know all the details of all the specific states, right? But it is done by case situation to find out what is happening within those particular families or situations, and looking at what would best suit that specific family. If there's a specific event that happened and that they're needing drastic surgery, then they may need to have to cancel that insurance in that state, because this is going to be more expensive than all the hoops that they'll have to go through to go back on the insurance in the other state, right? So it really is situational based, but we do use the resources out there. We'll go into the NCFH website too, look at what can we help this family with while they're on the phone, and then do soft handoffs to connect them together. And before we hang up, we make sure that everybody's got their numbers and situated so that they can get continued care.
Wow, very impressive coordination. Thank you for that. Bluegrass.
Yeah, very similar to Finger Lakes. It can definitely be a challenge, especially a lot of our farm workers who are in the horse industry. They might only be in town for 2 to 4 weeks. So it's definitely a challenge. They move around a lot. So we try to connect with where they move. There are hopes of trying to get a interfacility communication, much like Finger Licks is saying, but it just takes a lot of care coordination and preparation for these patients for sure.
Great, thank you. Thank you for sharing. This question is also for you, Elizabeth. How did you gain leadership support and buy-in for prioritizing a multi-language diverse team? And were there any challenges?
Yeah, that's a great question. So it has taken some time, and that is something that we have strived here at Bluegrass Community Health Center to have staff that look like our patients, and it just helps create a welcoming environment. So I've actually reached out to other health centers that have a very diverse team to get some insight in how we can support this within our facility, and that has helped. But really, we get a lot of our staff from patients. They see what we're doing. They see our mission. They want to be able to help. They can relate. We've started off with maybe just a couple, and it's really grown over the last few years because they might know somebody, or they have this passion to help and serve within our organization. So that's definitely helped. And then we have offered a medical Spanish class to some of our staff that maybe aren't proficient in Spanish or want to learn. And it's really awesome to see our staff participate in that class, and then hearing them in the clinic practicing their words that they use. And it doesn't have to be very fluent. You can really get the job done with learning a little bit of that terminology. So it's really exciting to be able to offer that and have such a diverse team. And I will say some of the challenges is just being cultural competent. That's something we talk about. We do yearly trainings. We discuss it. Just being aware and respectful, and we've definitely created a awesome community here.
Great, awesome. Thanks for sharing. Our next question is going to be for Finger Lakes. What future goals does your financial team have, and what's next for you all?
Well, here at Finger Lakes, every day is a new day. We start with one thing and then it evolves to something else. So it's always something moving. It's a moving target. I will say though that our patients, as our CEO says, is our North Star. So whatever the patient needs, that's what we'll go through. And we very much are looking to leverage the technology that comes our way, right? Whether it's artificial intelligence or resources that the technology gives us to be able to have us be more efficient and effective, great. But for our staff as well, they wear multiple hats, like I was saying earlier. So not only do they do insurance enrollment, but they're doing other trainings and awareness out in the community. So it's always evolving and changing for us. So the great piece about the future is that we can't really tell what's going to happen. I can tell you that we're always looking to continue to expand our collaboration and our team building with our partners in our community, and keep having those relationships or those bridges made within our partners, because that's what really helps our patients get access into care. And when a hospital comes across a person that needs help, they'll know to reach out to us, and we'll work hard to help them. And that's what really helps our patients. So continuing to work with our community partners and sit at those tables, whether they're subcommittees or whatever it is, whether it's public health or whatnot, we want to be at those tables and support the staff that are also trying to serve the same patients that we're serving. So I'm very much looking forward to what the future brings. But I don't think I really answered your question.
Oh, I think so. I think your patients are very lucky that you all are so committed and dedicated. So thank you for sharing that. All right, we have another question for the Bluegrass team. What future partnerships are you targeting for increasing access to care for ag workers?
Yeah, so we want to continue to get into the local farms, the horse farms, the racetracks, continue to be present, whether it be during that short period of racing time. We're here, come, and being accessible at different times, like where we have those extended hours and Saturday. It's very important for these agricultural workers to have those options. So to continue to work with our partners and grow our connections is definitely what we're striving to do, whether that be I pass something or any of us pass something on the way into work and you say, I've never heard of that. Let's reach out to them. Let's set up a meeting. Let's see how we can work together. What are your needs? What can we do? These are our services. That's something that we are continuing to grow on and build, and it's definitely paying off what we've done so far.
Great, thank you. Thank you for sharing that. One other question we have is, and I think you both, there's time for both health centers to answer this, is do you offer language training for staff interested in learning a new language? And I think one of that has already been answered, but we can expound on that if you would like. And do you recruit those that already speak the targeted languages? If so, how do you prioritize who receives this training? So Bluegrass, do you want to go ahead and start?
Yes, we do offer an intro medical Spanish class. It is open to all. We don't target one area or another. Medical terminology and medical Spanish is a little bit different than maybe some of our staff are used to. So we don't really prioritize who receives it or not. We've opened it up to all.
That's awesome. Finger Lakes, what do you offer?
Sure. Yep. So we did offer a program to have people learn a language, and we put that aside because now there's so many apps, so many resources out there for people to learn languages on their own, and it was difficult for us to keep the process going because we only had a certain amount of licenses. And let's say that I had a license and Elizabeth had a license, and Elizabeth is all gung-ho, she's getting through all the lessons, and I'm kind of stagnant, still on lesson 1, but I'm still taking up a license, right? And then Vanessa wants to join, but she's waiting for me to finish, and I'm still at lesson 1, so it takes forever for that to go through. So we decided to just look at what else was out there and have people use the resources that were out in the community. If the people that are really invested and want to put in the time, they're going to move on and do forward and move on to those pieces, right? So we left that there. But what we do offer is we have a program that we've been certified through Bridging the Gap, where we certify people to be interpreters. So we're not teaching them the language, we're helping them get through their career of being interpreters so that they can move on and either continue and get their national or their state certification, their national certification, and have that credential to say that they are interpreters. So we have that process within not only within our organization, but we offer it to our partners as well. They have to have their language, whatever language that may be, and they have to meet the language requirements. But then the program gets them that certification to say that they are certified. And then with our staff, our clinical teams, the people that use our interpreters, we give them a training to say, this is how your interpreter should be working with you, regardless if they are our interpreters internally or third-party interpretation service, an organization that we use externally, so that they are able to ensure that they're getting the doctors, the nurses, the front-end person, whoever's using a interpreter, that they're getting the correct service and that the patient is getting the correct service available to them. So we do provide that service in our organization.
Awesome, great. Bluegrass, do you have any nuances with your interpretation services? If you have a language that comes up from a patient and none of your team speak it, how are you able to support those patients?
Yeah, we do use interpreter services if we're unable to incorporate our staff to help with this as well. And also if it is something that requires a certified interpreter, then we would use these services as well. But like I said, we have a lot of staff that speak the language. So we try to connect our staff to come in and work with those patients when we see that the schedule is dependent on it. And we do offer a 10% incentive for our staff in their salary if they do speak another language for our top languages. So that's another way that we try to show, you know, the value of having that within our organization.
Thank you. Thank you, Elizabeth, and thank you, Serene, so much for these wonderful practices that you're offering your health center. It's so inspirational. And I'm going to turn it back over to Katie.
Thanks, Cindy. And thank you all for answering all those questions. It looks like we got through everything in the chat and Q&A box. But I would like to give everybody on the panel the opportunity to share any closing remarks if you'd like.
Yeah, this is Serene from Finger Lakes. I'd just like to give kudos to the team. It really is, you know, I'm over here presenting, but it is the team doing the ones that are on the in the ground, on the boots, as they say, doing the work, right? So it really is the folks that are with the patients providing the service. So it's really is the team that's doing the hard work and meeting our patients where they are. So I want to give them a special thank you for everything that they do. And thank you to NCFH for recognizing the work that our staff is doing.
I'll piggyback on that. We can't do it without our support staff across the whole board, from billing to yes, the folks that are right there day by day doing some crazy schedules to meet the needs of our patients. It takes a village to help target these our community and the challenges that we face daily. So it's kudos to the team. We couldn't do it without them. And thank you, Patrick, for helping get this award started and bringing it to our attention. And thank you all so much for having us. We really appreciate it.
Well, thank you all so much for all of the incredible work that you're doing and for taking the time out of your busy schedule, serving your patients to join us on this webinar. If we were all together, I'd have everyone give you a round of applause for receiving this 2024 IAC Promising Practice Award. We're getting some clapping reactions from our participants, so lots of kudos and gratitude for all of the hard work that you're doing. So thank you so much. We're gonna, this is the end of the recorded portion of this webinar, but we have a few additional resources to share if you're able to stick around.